Hi, my name is Vera Dubovoy. I am a board certified OBGYN and lifestyle medicine physician, and in May of 2022 started my own medical practice, Dubovoy Integrative Health. My talk today is entitled Let Food Be Thy Medicine. A lot of my patients do complain about being confused about nutritional advice and how that affects their health. And so I try to condense a lot of the nutritional research out there into this lecture, and I hope this is helpful. As a solo lifestyle medicine physician, I have no disclosures for this talk. My objectives for the talk are to discuss some of the health conditions caused by an unhealthy and standard American diet, review some of the evidence-based nutritional research that has shown and demonstrated reversal of chronic disease, and then learn some healthy foods to add to our dinner plate. And then we'll touch a little bit on the end about obesity, weight gain, and talk a little bit about sustained weight loss. So a standard American diet is sometimes abbreviated to a SAD diet. We know that it is the inverse of what we would typically call an anti-inflammatory diet or a Mediterranean diet. So the Western diet is typically high in processed foods, lots of sugars, and it is low in fiber. Doesn't have a lot of fruits and vegetables, and it focuses a little bit more on dairy and on meat. Whereas the healthier diets we think are more like a paleo-Mediterranean type diet, which is an anti-inflammatory diet and involves a lot of high fiber, whole natural foods, minimal processing, and as a result you get this microbiome symbiosis or this healthy bacteria in your microbiome in your gut. We know that over time, Americans tend to eat a little bit more meat and less dairy than in the past. So perhaps it's not necessarily what we eat that's causing these epidemics of chronic disease in our country, but probably the quality of what we're eating has declined over time. We know for sure that the dairy from when my grandmother was born in the 1920s is very different from the dairy that you find in the supermarket now. And we also know that sugar consumption has significantly increased over time as well. And it's hard to take a double take at this and really understand it, but 100 pounds per year per person of sugar is what we are consuming in the United States. And a lot of that is coming from beverages like sweetened teas, sweetened coffees. We know there's a Starbucks at every corner now. And a lot of this is also, of course, sodas. So the sad facts about this diet is that 9 out of 10 Americans don't reach the minimum recommended daily intake of vegetables. Nobody's eating enough greens and beans, orange vegetables, and whole grains. So there's been numerous studies that show the American diet is definitely not on par with any of the recommendations for what we should be eating. Now let's talk a little bit about fats, and I'm going to do a little bit more of a in-depth fat, healthy fat lecture on Let Food Be Thy Medicine later on, but fats are a major source of energy, and they actually help us absorb some vitamins and minerals. So all of our cells are actually lined with a phospholipid or a fatty layer. And they also line all of our nerves. So our myelin sheath surrounds the nerves, and this is made out of fat. So we know that fat is incredibly important for blood clotting, muscle movement, inflammation, and for multiple different aspects of our health. So if we look here at this cell membrane and we look at this processed saturated fatty acids covering the cell membrane on the left in the red, we see that the nutrients are not being absorbed there. Whereas if we have unsaturated fatty acid, for example, olive oil, extra virgin olive oil, then we are being able to absorb those nutrients. Some of our healthy foods and healthy fats are here outlined on the left side. And then I added some of the unhealthy fats on the right side. The unhealthy fats are mostly processed fats. The healthy fats are the unprocessed fats. So organic butter used to have a bad rap, and now we realize that organic butter is actually healthy. And then extra virgin coconut oil and extra virgin olive oil, especially first cold pressed. These are very, very healthy oils. Even though coconut oil is a saturated fat, it is a unprocessed saturated fat and can be very healthy. So fatty fish are also known to be very healthy. They also contain a lot of omega-3 fatty acids, which are our essential fatty acids. And so if you look over on the right side, we'll see a lot of these processed fats like margarine, which is the artificial butter spread and used to be very, very popular and touted as a heart healthy fat until we realized that the processing makes it unhealthy. So avoiding a lot of these seed oils like canola oil, cottonseed oil, processed vegetable oil is important because they do go rancid and they are not healthy. It's important to talk about a little bit about what's in dairy because we touched on that being kind of the hallmark of the American diet. So insulin-like growth factor, IGF-1, is found in dairy and cow's milk now. We've known that for some time because the purpose of cow's milk, of course, is to raise the little cows. And now, however, we're seeing a lot of antibiotics, hormones being added into dairy, and recombinant bovine growth hormone being added as well. So we used to think, cow's milk was healthy, and perhaps it was, like I said, different back in our grandparents' time. But we've realized now that, it may not be as healthy. So actually milk increases your risk of hip fracture and bone fracture and can even increase your risk of all-cause mortality from heart disease, cancer, and from dying from all causes. And perhaps this is more common in women than in men. So it's important to kind of take a look at what we're eating in terms of dairy and making sure that it's a good, healthy source. So what are some health conditions that are caused by the standard American diet? Well, here you go. 8 out of 10 chronic diseases are preventable by lifestyle. So really adhering to 4 simple healthy lifestyle factors can have a really strong impact on prevention. That's not smoking, not being obese, getting half an hour, 30 minutes of exercise a day, and then eating more fruits and veggies and less meat. So these 4 factors alone accounted for about 78% of chronic disease risk. And if we're able to maintain all 4, you drop 90% of our risk of developing diabetes, 80% of our risk of heart attacks, and half of our risk of stroke, and reduce cancer risk by over 1/3. So we're going to talk about a few of these in particular. The ones we'll be talking about are type 2 diabetes, heart disease, hypertension, and we'll talk a little bit about obesity and weight gain here at the end. So our research for diabetes is probably more than any other health condition, and we've shown with multiple trials that we can reverse type 2 diabetes as long as it's been within a short period of time from the diagnosis. So one of the big trials is here on number 1, the DIRECT trial. This enrolled patients with a diagnosis of type 2 diabetes on medications who all had their diagnosis less than 6 years from the time of enrollment in the study. And they were put on what we call a fasting mimicking diet, or a kind of like a almost starvation type diet, where it was very limited calories that they were taking in. So 850 calories a day for 3 to 5 months. And these were healthy foods that they were also consuming during that time. And they found that in the intervention group, so in the group of patients that were on this fasting mimicking diet, they had 46% intervention after the trial was finished, and they remained in remission at 2 years if they lost 10 kilograms during this time period. Another one of these studies was the Counterpoint study, looked at 600 calories a day, and also enrolled patients who were less than 4 years from the time of their diagnosis of diabetes, and they demonstrated similar findings. And the reason why is because there was normalization of the pancreatic beta cell functions, which secrete insulin, and increased hepatic sensitivity. And they normalized your fasting blood glucose with this trial. We know that lifestyle modifications actually decrease your diabetes risk 58% and is 2 times as effective as metformin. So why aren't our physicians doing this? Why aren't we offering a lifestyle modification for our patients? Because our healthcare system isn't set up to do this long term. So we don't have the time as physicians to really sit down with every patient and talk about prevention of progression from prediabetes to diabetes. And we don't have the education, we don't have the training either. So as physicians, we have to go out of our way to actually learn about a lot of these studies and learn about a lot of the health implications of nutrition. There's other studies as well that were really interesting. So plant-based diets dropped your hemoglobin A1C 3 times more, decreased your LDL 2 times as much, and lost more weight than medications and the American Diabetics Association diet, the ADA diet, which is the typical diet that's recommended for patients. And a couple more studies on diabetes, which I think are important, are this Anderson trial, which enrolled patients, just 20 patients who were on insulin and they were type 2 diabetic, in a lifestyle intervention, increasing the amount of fiber that they ate a day. So they had everybody have 65 grams of fiber a day. And in a little bit more than 2 weeks, 50% of the enrollees didn't even need insulin as a result of being on increased fiber. So we know for sure that there is great benefit with this fasting mimicking diet or limiting caloric restriction diet, because it regenerates our pancreatic beta cells. And we know that through epigenetics, we can kind of overcome a lot of our genetic predispositions, and we can reprogram our pancreas. and into having supportive beta cells again. For heart disease, it's really interesting to look at some of these studies that were done. I know the Ornish lifestyle heart trial is really important. He looked at patients that had coronary artery disease stenosis, and he actually could measure the stenosis. He does a holistic type of lifestyle intervention where he focuses on stress reduction as well as nutrition and exercise. And it is a mostly fruit and vegetable diet that he promotes. And he found that in the group of enrollees that were in this lifestyle group, they had a decrease in stenosis or narrowing of those arteries in the heart of almost 8%, while the control had an increase in their narrowing of the arteries by 27%. And this study was interesting and it was published in JAMA that showed, that the Atkins diet, Zone diet, Weight Watchers diet, and the Ornish diet, they all lowered your cholesterol markers, inflammation markers, and your insulin markers in similar amounts. So really it was just adhering to a diet other than the standard American diet that was important rather than being on a specific diet. The portfolio diet was interesting because it showed that food was as effective as a statin in lowering your bad cholesterol, your LDL cholesterol, and your CRP, which is a C-reactive protein. It's an inflammation marker that we can measure in the blood. So definitely, being exposed to these studies kind of gives us a little bit of an insight into what's helpful for heart disease patients. And really, it's what we talked about a little bit earlier. It's consuming healthier fats, so more of these polyunsaturated fatty acids, which decrease our coronary heart disease risk, and trying to avoid a lot of these added sugars in our diet, and consuming a little bit more of a healthy plant-based diet. Hypertension, we know from a lot of studies that, again, vegetables are really important. Consuming, not just limiting sodium, but also consuming a lot of potassium, magnesium-rich foods are important for hypertension. Making sure that we're taking a good look at all of our essential minerals for our high blood pressure risk. So this is a picture of me upside down after a call at the hospital when I was working in the hospital as a physician, as an OBGYN. And, I think our lives are all about balance. And, it's really important to think of balance in terms of proper nutrition, exercise, and stress reduction as well. So this lecture talks a lot about nutrition, but we do want to talk a little bit more about other aspects of life and balance in terms of a more holistic approach. So stress actually can be caused in our bodies from inflammatory foods. It also can be caused by disruptions in sleep, smoking, infections, toxins. So really, it can be all aspects of our life that can contribute to stress. So what are some stressful foods? Well, really, it's these high glycemic load foods. So these processed carbohydrates a lot of times, which contribute to overactive sympathetic nervous system, overactive fight or flight. It increases cortisol, which is our stress hormone, and affects our hormones in a negative way. We know that when we eat high glycemic load foods or high glycemic meals, that it also promotes fat storage. And we do want to focus on, when we have carbohydrates, making sure that they're complex carbohydrates and not simple carbohydrates, and that they don't spike our blood sugars, which sometimes can even cause crashes in our blood sugars and hypoglycemia, and can be sometimes very, very dangerous. We know that stress can affect all parts of our bodies, our brain and nerves, skin, muscles, joints, heart, stomach, and of course our intestines are really important. Stress increases our risk of diabetes. It causes a lot of reproductive issues for women that I see in my practice. And it also decreases our immune system and our ability to recover from illness. So also, maybe it's not just the quality of what we eat, but also what we don't eat, what we avoid. So endocrine disruptors are now all over us in our life. So avoiding toxins in our food and water supply, are really important. Plastics are really toxic a lot of times. So avoiding BPAs, trying to avoid a lot of these xenoestrogens, which mimic our hormones and our estrogens in our body and are found in the food supply, including in conventional dairy. Avoiding pesticides and herbicides, personal care products that have a lot of plastics and phthalates in them. So really, what's really important is avoiding these toxins. And, not all natural things are good for you. So lavender is actually also an endocrine disruptor, and we see it now more and more in certain foods. So trying to avoid ingesting lavender is also important. So now we'll move on to a little bit of some healing foods, and this is a fun part of our talk. So, we talked a little bit earlier about healthy fats. We know avocados are incredibly healthy in terms of their fat content, and they also have a good amount of fiber in them. So my grandparents had an avocado farm out in Southern California, and maybe that's why I love avocados so much, because it's in my blood. But definitely they're very, very excellent anti-inflammatory food that has a healthy amount of healthy fats and fiber in it. Artichokes also do have a good amount of fiber in them, and it has a lot of nutrients in it. And so I really like roasted artichokes in my omelets in the morning. They're very delicious healing food to add to your plate. And then let's talk a little bit about cruciferous vegetables. So cruciferous vegetables are really important for hormonal health as well, because they help promote healthy estrogen metabolism in the body. And so Brussels sprouts, cauliflower, broccoli, they're all high in vitamin K, potassium, folate, and in antioxidants. And so their fiber content is also very, very good, and roasted Brussels sprouts are delicious. Legumes are also really important in terms of healthy, healing foods. They're high in plant proteins, fiber, and lots of nutrients, and they're very inexpensive relatively. So black beans, are a wonderful source of food. We talked a little bit earlier about bad fats, and we know that microwave popcorn is full of chemicals and is not necessarily healthy. But if you can get some organic popcorn kernels, they actually are very high in fiber, and they're a healthy snack to have, as long as you're not putting, a lot of processed flavorings in it. Peanuts and peanut butter are also very good protein sources that are plant-based. They have lots of fiber, vitamins, and minerals, and they actually have a lot of protein in them as well. So this is of course not Jiffy peanut butter, but our natural peanut butter. We talked a little bit about fiber in a lot of these healing foods. Fiber is incredibly important for multiple parts of our body. It slows our digestion, improves our gut microbiome, and lowers our blood sugar and helps with our cholesterol as well. So we do think it's a good idea to have a mix of soluble and insoluble fiber. Insoluble fiber are things like whole grains and some vegetables, and soluble fibers are mostly vegetables like apples, artichokes, broccoli, Brussels sprouts, some of those cruciferous vegetables we talk about, as well as legumes. So we know that juicing removes a lot of this beneficial fiber, so it's a good idea to try to do smoothies instead of juicing if that's what you'd like. But definitely fiber can reduce the risk of heart disease, diabetes, cancer, hemorrhoids, and it's a great binder to remove toxins in the body as well. So now we'll shift gears a little bit and talk a little bit about fat, so body fat distribution. We know there's two typical types of fat distributions that we see: an androgen fat distribution, which is also sometimes cortisol related, is this android body fat, which is a central obesity that we see. And this sometimes is related to higher testosterone or high cortisol. And then the gynoid body fat is here, it's a distribution around the hips and the thighs, and is more typically related to elevated estrogen. I do think that anyone can lose weight. We know that fat is metabolically active and has hormones that are produced from fat. We know that hormonal imbalance is important for obesity and weight. Insulin resistance, we saw, if you have high glycemic load foods, can promote fat storage, and insulin stores fat. So, it's something that we can actually check in terms of labs to see if you have insulin resistance, even if you don't have diabetes. Estrogen and progesterone imbalance are also very important. Leptin resistance is also new, but it's becoming a little bit more popular to see. So leptin and ghrelin are two kind of balancing hormones, and ghrelin is a hormone that tells us we're hungry, whereas leptin tells us we're full. So if we are resistant to this signal telling us we're full, then we consume more than we should. So that's something we could also test in a lab test. And then, of course, avoiding these endocrine disruptors, which mimic our hormones and can affect our weight. Poor diet, stress, poor sleep habits, not moving enough, and misinformation are always important to point out, as well as reasons why sometimes we have trouble with weight. We do, in terms of movement, recommend 30 minutes 5 days a week of moderate level activity, or if you're doing vigorous level activity, 20 minutes just 3 days a week of vigorous level activity. So if you are looking to lose some weight, I think definitely some of the first steps to take would be increasing the amount of fiber in your diet. The majority of us don't get that 35 grams of fiber a day. Increasing the amount of vegetables that we take in our diet. And then, of course, incorporating more movement, purposeful movement in our diet. I do think living in this society, it's impossible to get all of our nutrients from food alone. We know that soil fertility has declined over the years, and not only in some of the contents of our food and vegetables, but in increasing some of the toxic minerals in our food as well. So, calcium, phosphorus, iron, riboflavin, which is a B vitamin, and vitamin C were all lower 50 years later. And then also magnesium has significantly declined, and the protein content of our food has declined quite significantly as well. So single nutrient imbalances can make all the difference in the world. So sometimes being on a multivitamin that's a high quality pharmaceutical grade supplement can be useful. But many supplements purchased are not necessarily usable and can create unnecessary imbalance in our body. So it's important to have good guidance for that. Some of the nutritional hot topics, I think, which I wanted to just click on really fast, would be gluten sensitivity and allergy. We see this really big in the autoimmune conditions, and it's something that you can test with a simple blood test. We know that lectins also can cause a lot of gut inflammation, and Dr. Gundry is another physician who has kind of popularized lectins. He talks about preparing lectins properly, so soaking them overnight, pouring out that water, using high pressure cookers to cook the lectins. These are all kind of important. We talked a little bit about good fats and bad fats, so trying to avoid seed oils and fats that can go rancid easily with the processing, and a little bit more of a focus on healthy fats. Avocados, of course, are healthy fats. Raw nuts and seeds are healthy fats. And then, of course, we talked a little bit about extra virgin olive oil and organic butter being also healthy fats. This idea of calories we don't think is necessarily an important part of weight loss, although, what exactly is a calorie, we don't really know, but we do know this idea of fasting is important. So doing fasting mimicking diets and focusing a little bit more, like we saw in the diabetic research, of trying to regenerate some of those pancreatic beta cells that may have been damaged, is something that can be done with fasting, with intermittent fasting. So typically, fasting can be done multiple different ways, but the condensed eating window is one way we see a lot of times of fasting. So it's 16 hours without eating, and typically eating kind of from like 8 to 4 during the day and not having any late night eating. And then we know that sometimes genetics can play a role as well in our health. So, checking for genetic inheritance markers like MTHFR, methylation defects are important. And, in terms of the microbiome, we saw on that inverse triangle picture at the very beginning of our talk, how you can get dysbiosis with the standard American diet and a microbiome symbiosis, or a healthy bacteria in the gut with the Mediterranean diet. And a lot of that's through these prebiotics, healthy foods that are mostly vegetables that contain a lot of the prebiotics in them. Omegas and essential fatty acids are really important, and having that balance of omega-3s to your other omegas is important as well. We don't get enough fatty fish and healthy omega-3s in our diet. And then this idea of homeostasis, of the body naturally trying to create its equilibrium and balance, I think is really important. So, I think what's really things to take home from this lecture, maybe it's Also, not just the quality of what you eat, but what you don't eat, avoiding toxins, avoiding foods with pesticides, avoiding allergens, and, avoiding these xenoestrogens. I do like this idea of Dr. Lodog's nutrition prescription. So she talks a lot about movement, meditation, community being important. And in her food pyramid, she talks about vegetables, getting 4 to 6 servings of vegetables a day. And then proteins as well being important. And a lot of these are plant-based proteins that you see here, legumes, nuts, and seeds. And then you'll see a little bit of like dairy and fatty fish there as well, being important. Really, limiting the amount of dairy and, of course, of sweets is important. For healthy fats and oils, she recommends extra virgin cold-pressed olive oil and organic butter, which I think are really important. We want to avoid those oxidized oils and rancid oils, seed oils that we had talked about. We think it's important to maintain a lot of vegetables in our diet, and avoiding a lot of those genetically modified foods as well. So I do talk to my patients about what the ingredients are for optimal function, and I think love and meaning are probably at the core there. We talked here about clean, nutritious foods, but also it's important to have clean air, clean water, purposeful movement, these normal sleep-wake cycles, and relaxation and self-care. So this is my joy. This is my son and my daughter here. And my daughter is giving my son a little hug, and we know that hugging and cuddling for more than 6 seconds can produce oxytocin and serotonin released at maximum levels, and this can be sustained for several minutes. So it's important for that love and meaning in terms of our health as well, because it makes us happy. And now we'll do just a little bit of this deep breathing relaxation, since we're kind of on that topic. So if we can just bring our feet down to the ground ourselves, sit at the edge of our chairs, and slowly start taking some deep abdominal breaths, expanding our abdomen on the inhale and relaxing our abdomen on the exhale. Inhale, expanding the belly. Exhale, relaxing the belly. And we'll do a little bit of this square breathing where we'll inhale for 1, 2, 3, 4. Hold for 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. One more time. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. And hold, 2, 3, 4. I do believe that the power that made the body can heal the body. Here's some great resources if you're wanting a little bit more information about nutrition and nutritional health. Mark Hyman is another physician. He's a functional medicine doctor. He produced a few books right now, and the newest one I think is called Food, What the Heck Are We Supposed to Eat? And he has a website, foodthebook.com, which I think has a lot of resources on there. Michael Pollan, of course, is a great resource out there. He has some Netflix docuseries out there on food, and he has published a lot of books like Food Rules, and one of those food rules is, whatever your great-grandmother cannot recognize as food should not be eaten. And of course we see a lot of that in the grocery stores nowadays. Some of these other physicians are also important to look at. David Perlmutter, I think, is a neurologist who talks a lot about gluten and grain brain. Terry Walls talks a lot about the autoimmune connection to diet. And she has multiple sclerosis herself and went on this autoimmune diet and did significantly better. And then, of course, the Blue Zones is kind of this popularized, interesting book about what areas of the world the inhabitants live the longest and what diets are they consuming. And there's only one blue zone in the United States. It's in Loma Linda, California, where a lot of the population there are Seventh-day Adventists, and they are mostly plant-based, vegetarian there. And then, of course, sleep is really important. We talked a little bit about that, but Matthew Walker has a great book on why we sleep and the importance of sleep, and he talks about circadian rhythms and the importance of sleep for that. There is also a free mindfulness-based stress reduction course online, which I encourage you to look at if you're interested in some stress reduction, because we know that our lives are quite stressful. And so transforming that stress in healthy ways is really important. And this is a picture of my family and I at our ribbon cutting ceremony, and we are open for business. So I do have a office in Williamsburg and in Richmond. I am on Instagram and Facebook, and I am always open to talk about nutrition and health if you want to shoot me an email. I do practice screen-free Sundays myself and try to avoid technology one day out of the week. And I plan on doing some more talks here in the community, because I do feel like community health is incredibly important. And hopefully we'll set up some more walks with the doc and maybe even some grocery shops with the doc sessions here in the future. My website is vaintegrativehealth.com, and I look forward to seeing you at some of my future lectures.